Renshen. The Asian ginseng is the most revered herb in the entire pharmacopoeia, and it's been that way for over 5,000 years, found in the mountains of Manchuria. Traditional doctors used it to restore what they called original qi, deep foundational energy, when someone was completely depleted. Modern science later identified over 100 ginsenosides in the root, which are steroidal compounds that modulate your stress hormone system, specifically the HPA axis. You'll find it in every major adaptogen supplement on the market today. However, it interacts with warfarin and can push blood pressure up, so consult with your doctor before using. Huang Qi, astragalus root, is the go-to herb for building what traditional medicine calls wei qi, the body's defensive energy. This is the herb cancer centers actually use in integrative oncology because its polysaccharides, specifically astragaloside 4, have been shown to boost T-cell and natural killer cell activity. When chemotherapy wipes out a patient's immune system, oncologists in China and increasingly in the West use astragalus to help the immune count recover faster. You'll find it in virtually every serious immune support supplement, and the clinical research behind it is some of the strongest in the entire herbal world. Gansao. Licorice root shows up in more Chinese herbal formulas than almost any other herb because its job is to harmonize everything else in the formula, smooth out harsh effects, and moisten inflamed tissue. And the active compound, glycyrrhizin, has real anti-inflammatory action and works as a natural emulsifier. It's in cough syrups, throat lozenges, and digestive supplements worldwide. The catch is that high-dose licorice over time can drop your potassium levels and raise blood pressure, which is why pharmaceutical companies isolate the glycyrrhizin and modify it for safer long-term use. Dang Gui. Chinese angelica is the foundational herb for women's health in the entire Chinese system, and the science actually explains why. It contains ferulic acid and compounds that act as phytoestrogens, meaning they loosely mimic estrogen in the body, which is why it's been used for centuries to regulate menstrual cycles, ease cramps, and support blood flow. It's also a mild anticoagulant. You'll find it in nearly every women's hormone balance supplement on the market. Wine-processed Dang Gui has even stronger blood-moving effects, which is why the processing method matters, because raw versus prepared aren't the same product. Huanglian, Chinese gold thread, contains berberine, and berberine is one of the most researched plant compounds in modern science right now. Traditional doctors use this bitter yellow root to clear gut infections and reduce inflammation. Modern research shows berberine lowers blood glucose as effectively as metformin in some studies, regulates lipids, and reshapes the gut microbiome. It's become one of the best-selling standalone supplements in the health and longevity space. Pure berberine capsules are literally just the extracted active compound from this root. The antimicrobial effects against gut pathogens are well documented and very real. Ma Huang, Chinese ephedra, is the herb that directly gave Western medicine ephedrine, the prototypical sympathomimetic drug used in asthma treatment and nasal decongestants. Traditional doctors used it to open the airways, induce sweating during early-stage infections, and push water out through urination. Ephedrine works by stimulating the sympathetic nervous system, so it raises heart rate, opens the bronchi, and constricts blood vessels. The problem is, it also raises blood pressure dramatically, which is why the FDA banned ephedra-based weight loss supplements in 2004 after serious cardiac events. The drug itself remains in pharmaceutical use. The supplement form is dangerous without medical oversight. Di Huang Rehmannia is one herb that completely changes its function depending on how it's prepared. Raw Rehmannia clears heat and cools inflammation, traditionally used for high fevers and bleeding. Steam it until it turns black, a process called wine steaming, and it becomes shu di huang, which does the opposite. Now it tonifies blood and builds what the system calls kidney yin, meaning it supports the hormonal and reproductive axis. Modern research on the active compound cattle pole shows neuroprotective effects and potential adrenal support. You'll find it in kidney tonic and anti-aging formulas in supplement stores. Wu Wei Zi. Schisandra berry is named the five-flavor fruit because it hits all five tastes at once: sour, sweet, bitter, pungent, and salty, which made traditional practitioners believe it was working on every organ system simultaneously. The lignans inside it, specifically schizandrins, have been well studied for liver protection and adaptogenic activity. Russian sports scientists actually studied Schisandra extensively during the Soviet era for athletic performance. You'll find it in liver support supplements and adaptogen blends. It's also one of the few herbs with documented evidence for improving focus and reducing cortisol without stimulant effects. Fu Ling, Poria mushroom, is a fungus that grows on pine tree roots underground, and it's been a foundational ingredient in Chinese formulas for over 2,000 years. Traditional use focused on moving excess fluid out of the body and calming an anxious mind. The main active compound, pakiman, is a polysaccharide with significant immunomodulatory effects in modern research. It's showing up in contemporary mushroom supplement blends alongside lion's mane and reishi. The calming effect is real enough that it's used in classic Chinese formulas, specifically for sleep and anxiety. Dan Shen, red sage root, is one of the most studied herbs for cardiovascular health in all of Chinese medicine. The active compounds, called tanchinones, improve microcirculation, reduce platelet clumping, and protect cardiac tissue from ischemic damage. Traditional doctors used it to treat what they called heart-blood stagnation, basically chest pain and poor circulation. The interaction warning here is serious. Dan Shen combined with warfarin massively increases bleeding risk because it hits platelet aggregation from a completely different angle than the drug does. It's in cardiovascular support supplements, but should never be stacked with blood thinners without physician oversight. Shengjiang, fresh ginger, is probably the most globally recognized herb on this entire list. Traditional use focused on warming the digestive system, stopping nausea, and pushing out early cold and flu symptoms. The active compound gingerol converts to shogaol when dried or heated, and shogaol is actually more potent as an anti-inflammatory. Clinical trials have confirmed ginger reduces chemotherapy-induced nausea significantly. It's in every anti-nausea supplement, ginger chew, and motion sickness product on the market. Fresh versus dried versus extracted are meaningfully different in terms of which compounds are active, which is why dose and form actually matter here. Bohei, field mint, is the cool counterpart to ginger. Where ginger pushes out cold-type infections with warming diaphoretic action, mint clears heat-type infections with a cooling dispersing effect. Traditional doctors used it for sore throat, early fever, and eye inflammation. The menthol in mint activates cold-sensitive receptors in the throat and airways, which is why it feels cooling without actually lowering temperature. It's in virtually every throat lozenge, cold and flu capsule, and respiratory support formula sold anywhere in the world. The IBS research on peppermint oil and enteric capsules is some of the strongest clinical evidence for any herbal product in Western medicine. Jin Yin Hua, honeysuckle flower, is China's go-to herb for acute infections, and it's one of the first herbs that gets prescribed when someone shows up with a respiratory infection, fever, and inflammation. It clears what traditional medicine calls heat toxicity. Modern analysis shows potent antimicrobial and antiviral activity from its chlorogenic acid content. During SARS and coronavirus outbreaks in China, honeysuckle-based formulas were part of the official government treatment protocols. You'll find it in throat and immune formulas, and chlorogenic acid itself is now sold as a standalone supplement for its antioxidant and metabolic effects. Qinghao, sweet wormwood, produced artemisinin, arguably the most important drug discovery of the 20th century. Researcher Tu Yoyu found a 4th century text describing how to use cold water to extract this herb for fever treatment, which led her to develop artemisinin, the gold standard treatment for drug-resistant malaria. The extraction method changed everything because boiling destroyed the active compound. Artemisinin-based combination therapies now save hundreds of thousands of lives annually. This is the clearest proof in existence that traditional herbal texts contain real pharmaceutical intelligence. Chuan Wu, aconite root, is one of the most pharmacologically powerful and genuinely dangerous herbs in the entire Chinese system. Raw aconite contains aconitine, a diterpene alkaloid so toxic it was used on arrow tips and can cause fatal cardiac arrhythmias in small doses. Traditional processing, prolonged boiling or steaming for hours, hydrolyzes the toxic alkaloids into much safer derivatives called benzoylaconine and aconine that retain strong warming and pain-relieving effects without the lethal cardiac risk. Processed aconite is the primary herb for severe cold-type pain, joint disease, and metabolic collapse. Using the raw form without processing is genuinely life-threatening, and several modern poisoning cases trace back to improperly prepared aconite. Bansha Pinellia is another herb that's toxic raw and safe when processed correctly. In its natural state, it causes intense throat irritation and mucosal damage. Processed with ginger juice and alum, it becomes one of the most effective expectorants in the Chinese system, breaking up phlegm, stopping nausea, and calming stomach reversal. Basically, it's a remedy for vomiting and acid reflux. The processing chemistry is well understood. The ginger compounds neutralize the irritant raphides. You'll find processed Pinellia in Chinese patent medicine formulas for nausea, cough, and digestive upset. Sanqi, Panax noto ginseng, is ginseng's blood-stopping cousin, and it does two things that seem contradictory until you understand the chemistry. It stops bleeding and moves stagnant blood simultaneously. Traditional doctors used it for traumatic injuries, internal bleeding, and cardiovascular stagnation. The saponins in it activate both hemostatic and fibrinolytic pathways depending on what the body needs. It's now used in Chinese hospitals as a cardiovascular drug called Shuxuan Tong, and the injectable form is standard treatment for ischemic stroke in China. Supplement companies sell it for cardiovascular support and post-workout recovery because of its tissue repair and circulation effects. Chai Hu, Bupleurum, is the primary herb for what Chinese medicine calls liver qi stagnation, which maps roughly to stress, emotional tension, and the physical symptoms that come from chronic psychological strain. Tight chest, digestive issues, mood swings, irregular periods. The active psychosaponins have been studied for liver protection, anti-inflammatory effects, and modulation of the stress response. One of the most prescribed Chinese formulas historically, Xiao Yao San, has Bupleurum as its chief herb, and it's the formula that integrative oncology studies flagged as being widely co-used by breast cancer patients on tamoxifen. Baishao, white peony root, is used in more Chinese formulas than almost any herb except licorice, and its job is to nourish blood, ease muscle tension, and moderate pain. The active compound pianoflorin has documented antispasmodic, anti-inflammatory, and estrogen-modulating effects. It shows up in nearly every gynecological formula in Chinese medicine. Modern research is investigating pianoflorin for autoimmune conditions because of its regulatory effect on T-cell activity. You'll find white peony extract in hormone balance supplements, PMS formulas, and anti-inflammatory blends. Huangbai, philodendron bark, is the second major berberine source alongside goldthread, but it targets the lower body specifically in the traditional system. Kidney infections, urinary tract inflammation, and damp heat conditions below the waist. The berberine content is comparable to huanglian, with the same antimicrobial and blood sugar lowering mechanisms. It's used in supplements for urinary tract support and metabolic health. The combination of philodendron with Anna marina, called Jibai Di Huangwan, is one of the most prescribed Chinese formulas for menopausal symptoms and is studied specifically for its estrogen modulating and anti-inflammatory effects in that population.